Emergency services personnel in KwaZulu Natal are fearing for their lives. Paramedics have described how they're being targeted by criminals while responding to emergencies. Some have been kidnapped, shot at and robbed of their equipment. ENCA's Letiwe Mdluli reports that unions are now demanding safe working conditions and protection for healthcare workers.
It seems no one is immune to the country's rampant crime. Paramedics have been targeted by criminals while on the job, not only endangering their lives, but the lives of patients as well.
We've had a lot of crime-related incidents. Personally, I've been attempted hijacked in an ambulance. I've been held hostage. I've been shot at numerous times. I've had bricks, rocks thrown at us. One incident was during the July riots where we came under fire whilst transporting a very young little female that was in a critical condition. Someone opened fire on us with an AK-47 during those riot times. So yes, the crime does exist, and it is a constant siege that we deal with.
We've been threatened for helping people. Obviously, sometimes the community, it could be a suspect in their eyes, and we've been threatened before. We've been rocks or bricks have been thrown at the vehicles, or bricks that have been placed in the road to try and what we assume is an attempt to hit it or hijack the vehicle.
The first responders complain that this has been an issue for many years without any kind of proper intervention.
As the private industry, we are a little bit more lucky than some, because we are able in some instances to pick and choose the areas that we go to perhaps. We do have a client base that we go to, but that's not saying that we will exclude people. If we receive a call in an area, we will still go there, but we do have to be mindful about the areas that we go to. When it goes into the more rural areas where we don't have that kind of luxury, we definitely need the assistance of SAP.
What would assist us is a quicker response by SAP mostly to escort us into it, because obviously they're also very busy, which then delays our time to get to a dying victim.
Unions representing health workers say the entire KwaZulu Natal province is a hotspot, with incidents of crime taking place everywhere.
Our EMS personnel are not safe. The hospital staff are not safe. It's because the issue of the safety not been taken care of by the Department of Health. In fact, all of them in the province are hotspots. We'll find that sometimes the EMS are now refusing to go to certain areas because they know that if we go, they are going to be hijacked.
Unions are demanding protection of their members and want more security to be deployed.
We would want to see increase the number of guards that are guarding these facilities. In some instances, we have raised a call to say, can they be armed? Because people who force their entry into these facilities, they are armed most of the time, and they are not capacitated to deal with that situation. Or at times we've asked that they must also involve SAPS.
We reached out to the health departments in the province for comment on this issue with no success. Letiwe Mdluli, Durban.